All right. Well, welcome everybody. This is Leah Wilder with Wisconsin Primary Healthcare Association. I've worked with a number of folks at the different health centers across the state, and we are really excited to be partnering with Care Message to bring you a webinar this afternoon regarding text messaging strategies for you all in reaching folks who are needing access to vaccines. And so I'm really delighted to be partnering with Christine and Jessica at Care Message to talk about this with you all today, and I hope that you find it valuable and welcome.
Wonderful, thank you, Leah, and thank you to Wisconsin Primary Healthcare Association. Thank you to everyone who's making the time to join us for today's webinar. I realize that, and we realize that many of you who are coming directly from health centers are taking the time out of your busy afternoons to learn from each other, to hear from us, and please feel free to submit your questions in the comments or in the Q&A along the way. We're happy to make this as interactive and responsive to the questions and topics that are most pressing for those on today's call, and how we could potentially work together to address those concerns with text messaging. For today's webinar, we will do a brief overview of Care Message, who we are as a nonprofit organization, our text messaging solution, and then of course focus on our COVID-19 vaccine communication strategy and the use of our free platform and how health centers are leveraging text messaging to navigate this time and their individual health centers' vaccine operations. Just a brief bit of housekeeping. Again, please use the Q&A, use the chat for any questions or comments that you'd like to submit. We will be sharing a recording of today's webinar, as well as the presentation. We'll be sharing that out via email so that you can share this with your colleagues. Wonderful, let's get started. Just a brief overview of Care Message. We are a 501c3 nonprofit organization. We are a nonprofit that builds patient communication technology, founded in 2012, and we're exclusively focused on underserved communities and reaching underserved patients through SMS text messaging. As a result of our focus and mission as a nonprofit organization, we of course only and exclusively work with safety net organizations, primarily federally qualified health centers, community health centers, and free and charitable clinics. We are so grateful for the partnership of organizations like other PCAs and HCCNs across the country who help us put together recommendations that health centers can ultimately implement based off of what's going on, whether it's in response to the pandemic or even more broadly to the quality initiatives and the communication initiatives that your health center may have. We'll talk briefly about outcomes. We'll talk about the impact that we have and that we've measured with text messaging and the efficacy of SMS and mobile. And today we're really proud to partner with a handful of health centers already in Wisconsin, including Progressive CHC, Gerald L. Ignace Partnership, and many others. For those of you who are not familiar with Care Message, just a brief overview of our full platform. We are a comprehensive messaging solution designed for FQHCs. Traditionally, we see health centers approaching us with one of two goals in mind. Perhaps they're thinking about bidirectional appointment reminders, integrating that directly with the EHR, and then being able to address other types of use cases, typically of the quality messaging initiatives that they have through group outreach, which is the ability to send a single message out to hundreds or thousands of patients to address things like preventive screening reminders, to fill gaps in care, as well as addressing non-clinical needs. So any type of social services, any type of community events, or even just health center operation updates that need to go out to your patient population, like clinic closures or a change in hours. We do have a quality focus, so we do offer health education programs as well. These are bidirectional text messaging programs that are designed to address a specific chronic condition or behavior change, and a few examples of those are our type 2 diabetes program, hypertension, addressing exercise, We also have a social determinants of health survey to be able to identify social needs amongst your patient population, as well as one that's more proactive, so suggesting services and making sure your patients are aware of that without necessarily surveying them. In addition to building a robust and comprehensive text messaging platform that not only integrates with the EMR, but also with population health management solutions like Azara, we of course have a heavy focus on content. We have worked with numerous experts over the years to develop our clinical content library. We use motivational interviewing and value-based affirmation and look to clinically proven approaches to behavior change when we think about our clinical content. We have a patient advisory board that actually takes a look at the content as well. We have a director of health outcomes and research and a product team that's committed to looking at the efficacy of messages themselves, so evaluating things like tone, vocabulary, of course, crafting all of our content at a 6th grade reading level or below. 40% of our content is written at a 4th grade reading level or below, and all of our content is offered in both English and culturally relevant Spanish translations. As you see in the example here, and as you'll see in the demonstration today, and as we talk about our free solution, CareMessage is a bidirectional platform. So of course, being able to collect responses, whether they are structured in yes/no format or multiple choice format, is an option, as well as open-ended responses from your patient population. We could probably spend an entire webinar talking about the different integrations that are available to our users today. I just want to make mention of course, the technical platform and the importance of interoperability for our full platform users, and for those perhaps who are seeking a solution to either complement the messaging that they're doing in the EMR, to replace the messaging that they're doing, and then of course address all the use cases that we just discussed. We support integrations built via HL7 API, SFTP, and FHIR. We'll transition over to talking about our COVID-19 vaccine at this point. And as some of you may know, close to a year ago at this point, CareMessage launched what we call CM Lite, our free platform, and launched our first initiative, which we called Project Equity, which was and is a concerted and focused effort to reach safety net providers who were and are serving patients who were and are disproportionately affected by COVID-19. Towards the end of 2020, as vaccine approvals were moving forward, and now that we're very much in the inoculation period, we've put together a COVID-19 vaccine strategy and set of messaging solutions that we'll talk about today. And of course, a set of recommendations and workflows that health centers can now adopt to be able to adjust to this fluctuating circumstances and as their health center operations have changed. CM Lite, this is our free solution. So just to be abundantly clear, CM Lite is a free solution for any provider or organization on today's call. It is subsidized through our generous philanthropic partners like Johnson & Johnson and other regional funders who are supporting the work that CareMessage does. We offer CM Lite for a minimum of 60 days free to any safety net organization. And upon 60 days, should your organization continue to needing to use CM Lite, you can let us know and we'll work with Johnson & Johnson to have an extension granted. To date, we have not cut off any health center or user of CM Lite from the platform. And again, there's no long-term commitment or obligation to purchase our full platform. So really want to make that clear that even if your organization today uses text messaging with another vendor out of your EMR, maybe out of a care management system, but you still need the flexibility to send out messages on a one-to-one basis or to reach your population at scale, please reach out. You can use CM Lite, and we are so happy to offer that, especially during this time. CM Lite, as you can see, is a pared down version of our full platform. So group outreach is that ability to send a single message out to hundreds or thousands of patients. And direct messenger is the one-to-one patient follow-up. And again, no limit to the use case around direct messenger. It's most akin to the one-to-one text messaging experience that any of us might have in our day-to-day lives. CM Lite is intentionally designed as an unintegrated solution so that health centers within a matter of days or even hours can create a username and login and begin uploading patient lists and contact information to send messages out. And we'll walk through what that actually looks like in the demonstration. And then, of course, in addition to the platform, we offer the comprehensive message library that organizations need right now to address not only COVID-19 vaccine use cases, whether it's letting your patients know that your center doesn't yet have the vaccine, or perhaps you've run out of the vaccine and thus will be postponing any appointments for the next 2 days and need to reschedule those. But we also offer a broader library which addresses any type of COVID-19 vaccine use case of things like social distancing, telehealth, reinforcing hand hygiene, letting patients know about testing availability. And this library is free and available to the public. So again, even if your organization chooses not to use CM Lite, doesn't use Care Message today, please feel free to visit the library so that you're not in a position of recreating the wheel for messages that our Vaccine Advisory Board and our team of experts have put together. To date, we've seen our users send over 1.6 million messages specifically to address the COVID-19 vaccine itself. We've seen over 25 million messages go out to address COVID-19 more broadly. And just a few examples that we've called out here are just designed to show you how flexible CM Lite can be, whether you're sending out a survey to your patients to identify whether or not they have interest in receiving the vaccine. And that's the example you see in the top left-hand corner, as well as the top right-hand corner, but also being able to ask patients and letting them know, hey, this is a reason why you should be calling into the health center, and being able to direct patients to resources that maybe are on your website or are on your Facebook, or directing them to the CDC site so that your call center ultimately isn't overwhelmed with patients calling in with the same type of question. And we'll talk about that as well as a recommendation and what we've seen our health center partners use. Again, the library is public, it is free. We'll be sharing the link to the library in the chat during today's webinar, and it'll be included in the follow-up that you receive in a few days about this webinar and with the recording and presentation. But just wanted to share a few examples of the types of messages that we've created the content for. I think it's important to address that with Care Message, the recommendations that we've put together come directly from our FQHC users, come directly out of the conversations that we have with folks like Leah and other PCAs nationally, as I hear directly from CHCs and FQHCs about what are the strengths and constraints, what does the reality look like on a day-to-day basis or on a weekly basis, as so much information and even just the level of vaccine supplies have changed in the course of weeks and months. So some of the questions and some of the things that we've seen our health center partners consider are, how can we proactively address common patient questions at scale? How do we get in front of phone calls that might be inundating our call center staff? How can we direct patients to different resources that we have? And of the questions that we're receiving, which ones still do require that one-to-one conversation with patient access or with a nurse or someone on call? A huge topic right now is how do we leverage the trust we have with our patients, addressing vaccine hesitancy, and driving confidence in the vaccine is something that's very top of mind for our partners, especially now as vaccine supplies are increasing. And we'll hit a tipping point, of course, where the demand for the vaccine may actually drop below the supply. And so we'll really start to work together with our safety net providers to reach those who may be vaccine adverse for a variety of reasons. And then how do we collect information and survey our patients to better assess the operational and logistical needs? There are a lot of different ways to address this. We've just jotted down a few ideas that we've heard, that we've seen our partners use. and we can go through them, but of course, letting your patients know, for example, that your health center might not yet have the vaccine or has encountered delays is a great way to alleviate some of the inbound inquiries that patients may be calling in about. Letting patients know that you'll let them know when they're eligible is also a great way to, again, alleviate some of the phone calls that may be coming in. I know that, and we've heard that Wisconsin moves into phase 1B starting March 1st, which increases the population who becomes eligible. So how do you actually get in front of those patients and be able to address the questions that they might have, knowing that eligibility cohorts change in the coming week? We talked a lot about showing links to websites, FAQ sections, online resources that are regularly updated, letting your patients know that you'll be in touch with them. And then, of course, when we think about trust, how do you continue to be a source of factual clinical guidance? What role does your health center typically play when addressing, the clinical needs that your patients have, or the questions and maybe perhaps the misconceptions that they might have with other areas? And how do you leverage that to really drive trust and to create that community bond that you already have? And then, of course, we'll talk about just the different types of responses and ways you can collect information. Before we dive into some of the use cases, I do want to address one of the questions that came in through the chat. Can this tool be used to reach out beyond COVID? There has been some patient attrition for various reasons, such as COVID or civil unrest that we are trying to stem. And the answer to that is yes. Please, let us know, how specifically we can help, not only beyond offering this solution, but perhaps if there is content that we have created already to address some of those questions, civil unrest, and of course, during the very difficult summer that we saw our nation go through as part of our COVID-19 library, we actually did release messaging content to address the civil unrest that was going on, to direct patients to mental health resources and other sources that health centers had within their communities to support patients during that difficult time and to show their solidarity with the Black Lives Matter movement. And so, again, to be very clear, yes, this can be used for that as well. We'll go ahead and talk about some of the use cases and the recommendations. And then from there, we'll actually go into the demo environment to show you what it looks like to set up SAM right. There are three major use cases or workflows that we see our health centers adopting right now. The first is, of course, just continuing to provide public health guidance and ongoing education to patients, not only about the vaccine, but of course, as there's more information about the variants that are being discovered, double masking as a recommendation. We're allowing health centers, of course, to ultimately make that decision as to what is appropriate to communicate to your patient population. But of course, something that we see ongoing, taking place on a daily basis to ensure that your patients, again, have access to factual information and know and trust the health center, of course, already as a source of information. The second is targeted eligibility outreach. I can imagine this is extremely top of mind for the folks on today's call, knowing that Wisconsin moves into phase 1B starting March 1st. Perhaps you're even thinking beyond that, how to actually reach patients or folks in your community who aren't a part of your known patient population. So being able to send out messages to population and contacts who, through your community health partners, know that these are folks who are eligible for the vaccine and perhaps don't have other avenues, and another access might be a challenge here. So letting them know that, hi, for example, we are Care Message Health Center. We are here to support you. Please reach out with any questions. We're offering the vaccine. This is a great way to use SAM Lite, especially when you're reaching those who may be unknown to your health center prior to COVID. We've seen two use cases for eligibility specifically. So one, of course, is proactively letting patients know that they will be eligible for the vaccine. And then the second is for those health centers who anticipate that they'll have interest from patients who are not eligible and creating a wait list. So being able to reduce vaccine waste to make sure that they can easily access a list of patients who have indicated that they are interested in receiving the vaccine. At the end of the day, we have health centers who are sending out those messages to patients, whether they have 10 vaccines left over or 20, and letting patients know, hi, this is Care Message Health Center. If you're able to come in, first come, first serve for our leftover vaccines. We see health centers doing this on a daily basis as they, of course, try to reduce waste. And we even have an example from an FQHC in Wisconsin where they sent out the message, the COVID-19 vaccine will be available at our health center soon. You're eligible to receive it once it arrives. Are you interested? Yes or no? And then, of course, with health centers now administering the vaccine, we, of course, see the use of CM Lite and our full platform to actually schedule and coordinate vaccine delivery and inoculations. So not only with CM Lite can you schedule inoculation visits, you can remind patients of their appointment with RSVP instructions. So being able to confirm that patients will be coming in, perhaps being able to address access with respect to transportation. We've seen that come up as well from our health center partners, letting patients know proactively about vaccine safety and symptoms that they might experience. So again, just providing that reassurance to them so that they know what the experience will be like, and being able to do any one-to-one follow-up after dose 1 or dose 2. So quite a few examples here on the right-hand side from your peers in Wisconsin. I won't read through all of them, but again, just wanted to show you how nuanced the messaging can be specific to how your health center is perhaps scheduling visits, the guidance you want to provide to your population, and then the way in which you actually want patients to take that next step, whether it's having them call in or even scheduling that visit via text message through the one-to-one direct messenger. Before we go into the CM Lite demonstration, I do want to make mention of our partnership with Azara. We do have, as many of you may know, a partnership with Azara Healthcare for a solution that we call Azara Patient Outreach. This is to address quality measures through automated messaging campaigns. And of course, in response to COVID, created a specific COVID-19 set of use cases related to the vaccine to address eligibility. So being able to use the data and drives to identify patients who are eligible for the vaccine or will be eligible for the vaccine, and then being able to send out messages to remind patients that they should be scheduling their second dose if it's not already scheduled, based off of the vaccine type that they receive, Moderna, Pfizer, and hopefully, perhaps others in the future. And so I do want to make mention of this solution that's available to our users as well. And for the sake of transparency and just, an abundance of clarity, this is a paid solution that is highly subsidized, of course, because of what's going on. But please feel free to reach out to Care Message or Azara if this is a solution that you'd like to explore as well. I will go ahead and transition over to the CM Lite platform. And in today's demonstration, just in the interest of time, we'll take you through an example of how to actually get started with CM Lite. You will notice in my demonstration environment, I'm in a full platform environment. So on that left-hand side, you see a lot of the messaging functionality that you may not see in a CM Lite environment, such as the appointment reminders or the referrals or programs. Nevertheless, we'll go through the CM Lite workflow here, which starts with, upon logging in and getting started with the platform, you'll be able to upload patient lists and contact information into CM Lite through our File Center. I'll navigate over to the File Center. In the top right-hand corner, I have the ability to upload that list into Care Message, which takes a matter of minutes, depending on the file size. In the file, of course, we're collecting information such as patient first and last name, phone number, language preference, and other demographic data that you may want to have directly in Care Message. And upon going through that file center upload process, you do have the option to create a group. Now, for those of you perhaps who are using Drives or using Reporting Workbench or a solution out of the EMR to create specific patient cohorts, this is a great way to actually take that cohort that you might have created in Drive, upload that group directly into Care Message or CMLite, and create a cohort of patients who you want to reach. You don't have to do this, but this is a part of the workflow so that you can always go back to this same group of patients. And of course, you'll always be able to see the entire patient population under the Patients tab here. Once you've uploaded your patients into the platform, you can begin sending messages. So I've navigated over to group outreaches. At a high level, you can see within the dashboard, I can see within my organization all the different messages that we've sent out, whether it is addressing telehealth, whether it's addressing social distancing guidelines. I have a sense of what are all the messages that have gone out from say Progressive Health Center or Care Message Health Center as a different example here. And I can actually click into a specific campaign or message to see who were the patients that we reached out to for the flu shot. What was the overall response rate, the retention rate? What was the actual content that we sent out? And then clicking into the specific patient list to see who applied to this, who was saying yes or no, that they did or did not receive the flu shot this year. And in a list of 30-some patients, it's obviously very easy to take a look at the list and eyeball it. But of course, as you can imagine, when reaching 300 or 3,000 patients, you'll want the ability to filter by patient response. And should a patient ever reply with something unrecognized, maybe they say, who is this? Or I need help with this, Care Message automatically flags that response for review. I will pause just to address one question that did come in. What file types are able to be uploaded, and do they need to be uploaded in a specific format? We do require a CSV format for the file center. I will go ahead and actually walk us through what it looks like to create an outreach campaign. So in that top right-hand corner, I clicked on Create Outreach. From there, I can select the patients who I want to reach with this message. If I did create a group in the File Center upload process, I can select that group, or I could automatically, I can on the fly create a group based off of the demographic information that I might have uploaded in the files. I'll select the patients who I ultimately want to reach, and then from there have the ability to select a template, perhaps one that my organization has already used, because let's say in this example, we're trying to identify patients who are interested in receiving the vaccine and are interested in receiving a notification if there's any leftover vaccines for them to come in. We can select that template. We always have the ability to go to the Care Message public and free library and perhaps just copy and paste an example of a message that we want to send. So perhaps using the safety template here to address common questions or concerns that patients may have. And we can directly copy and paste that into the body here. We do have the ability to structure the outreach as a yes, no, or multiple choice question, or that open-ended response that I referenced. And then finally, upon creating that message, we can select a date and time that it should be sent out at. In addition to the ability to send out messages to hundreds or thousands of patients, we of course offer direct messenger and CMLite, which is the one-to-one patient messaging functionality. As you can see in the demo environment, we have some examples here of patients who, perhaps we've reached out to. As you can see, we have the ability to send and create messages that are custom, that are responsive to the patient. We also have the ability to use different templates that perhaps maybe we're doing one-to-one follow-up, but we're asking 10 patients or 100 patients the same question post-vaccination as a great example of one, or perhaps patients who have connected with a local community partner for a social service such as a housing agency. You can actually see that example here where we do follow up with the patient, Cecilia, to ask or be responsive to the question that they have. What's powerful about direct messenger is that even though it is one-to-one messaging with a specific patient, within your health center, you can actually see the different staff members or providers who have communicated with that patient. So in this example, you can see that perhaps my colleague Orit actually replied to the patient. If the patient reached out after hours, we have an autoresponder feature, which just lets patients know that we'll be getting back to them as soon as we can. And you see another example of a different member of my team reaching out to this patient. That concludes the walkthrough of CM Lite. I'll go ahead and go back to our presentation here and would love to open up the webinar to questions and ideas and perhaps recommendations that you all have used CareMessage or other text messaging platforms for addressing vaccine operations.
This is Leah. Has anybody on the call used CareMessage or any form of texting as part of their vaccine outreach? Or has anybody been exploring this at all?
Feel free to unmute yourselves. We've enabled that in response to Leah's question.
I guess the other question I would have for this group is, if you haven't been using texting, have you been running into any other challenges with trying to get your patients in, knowing that you've been mostly trying to work with your folks who are 65 and over? Have you been running into challenges there, and might there be space for texting as part of the solution to that?
It looks like we have one response from Ryan Smith at Partnership. Apologies for the audio problems. His response, and I can imagine many can see it in the chat, but I'll read it out loud. Partnership CHC has used care message, of course, to gauge interest from the 65 plus group. And, you know, this is something that we've seen quite often. And Ryan, if you don't mind using the chat, or if you're able to unmute yourselves, would be curious to know, you know, how you were posing this question, if you were collecting yes, no responses, or encouraging patients to call in. Just curious to learn a little bit more about how you went about this, and ultimately if you deemed it to be a successful outreach.
Yeah, so I think, can you hear me? I think I got my audio issues sorted out.
Yes, we can hear you. Okay,
perfect. Yeah, so we formatted it as a yes, no response, just to kind of to gauge interest in you know, who would want, or you know, just to get an idea of how, first of all, of how many people were interested in it, and then we use that kind of directly to launch into our outreach to patients and getting them scheduled. Overall, I think minus a few stumbling blocks at the beginning, when in wording, I think when we were gauging interest, we got some responses that, or the first text we sent out, our call center got bombarded temporarily with people who, even though we made sure to, you know, clearly state that we didn't have the vaccine yet, you know, we got a flurry of questions to our call center. After that, I think it went pretty smoothly. I was actually fairly surprised at the response rate from this particular group. Yeah, I think we, out of the 400-ish seniors that we sent it out to, I think 100 of them responded yes. So I was I mean, that's far higher than you know, any of the other sort of text outreaches that I've done. So I was I would say it was a huge success.
Thanks for sharing that. We had an FQHC in Louisiana that I think similarly found themselves, and their call center specifically, just completely inundated with calls for a slightly different reason, but one that I want to share with the group, which is that as their patient population was just hearing the news, whether it was a news outlet, maybe just folks in their community or in their personal lives mentioning that they had heard that a provider or an organization had the vaccine, that they would immediately be called, and patients would then think of, you know, this health center and want to reach out because they were curious. And so they found themselves similarly fielding, I think they had about a call center team of 6 folks, and they were receiving over 800 calls per hour because they knew their patients were thinking of them and wanted to come to the health center and the providers that they knew for the vaccine. So, you know, can definitely appreciate, and I've heard from organizations beyond yours and the one that I'm mentioning, that their patients thought of them and wanted to hear updates directly from the center.
Yeah, and I think, I mean, we're still kind of playing around with how we're going to do this 1B, but we're playing around with some ideas of utilizing the text to text out the link to the sign up page for our vaccine. So don't have the logistics quite worked out yet, but that's something that we were definitely interested in looking at.
Well, thanks for sharing that, Ryan. I'm curious to hear if any others on the phone are planning to incorporate texting into their strategies as well. If you've got questions or if you have things that you're still working through, this might be a good opportunity to talk through that with others who are also doing texting.
Can you guys hear me?
Yes.
Great. Hey, Greg Powell from Kenosha Community Health Center. I just got pulled away for a second. I was talking to our CEO just a little bit about this because this is pretty intriguing, this particular tool. And I'm a little bit newer to the center, so I'm still learning actually kind of the groundwork and the players and the different tools that are out there. But you guys seem like you're an outstanding resource. I'm the one that had sent the text about the kind of the attrition of patients a little bit over the last year for COVID primarily, but also it's been a little there's been some unrest in Kenosha that have probably kept people sheltering at home and things like that. So we're kind of working through trying to come up with a program for understanding who's been coming in, who we haven't seen for a while, and really kind of reaching out and saying, hey, we're here. I know you've probably been, at home or whatever for lots of different reasons, but, we'd like to get you in for a wellness check, and it sort of opens up the conversation on the whole vaccine thing and the whole phase 1B, bit that's going to be kind of transpiring here pretty quickly. So I definitely want to go down that road. Not sure exactly what's available to us. I know we're a member, otherwise I wouldn't be on the call probably. But anyway, yeah, just so you know, there's some, pretty good interest here on our end to explore this a little bit further and how we might put it into action pretty quickly here.
That's wonderful. Thank you for sharing that, Greg. And we can definitely do some follow-up after today's webinar to, connect you with someone who can do maybe a more customized walkthrough or just get you all started on the platform. I think you bring up a really important point, and one that may be under discussed during this time, where I think many health centers are forging ahead and feel the demand from their community to, schedule inoculations. But again, thinking about those who perhaps don't have the same level of demand or level of urgency to be vaccinated, and how do you initiate conversations today in anticipation of needing to reach those people in 3 months or 4 months or 5 months, for the vaccine, but as you, rightly point out, just for general wellness and bringing them back in for services that they otherwise perhaps would have comfortably been coming to, or perhaps not. And what's the role of text messaging? So I know I'm summarizing a bit of what you just described, and curious to see if there are folks on the call who are thinking about this as well. So I'll pause here.
Yeah, it's Greg again. I don't hear anybody chiming in, but I just think there's a really good opportunity here to kind of rekindle that connection with our patient base. And, I even think about our kids out there, and, there's been struggling with, virtual school and all those different types of things. Hey, parents have struggled with it too. So there's another reason, just to say, just check in on currency of vaccinations and, well, baby care. I mean, there's lots of opportunity. But so anyway, I'll look forward to talking to you guys offline about how we might create something, meaningful and actionable for our health center, and we can kind of go from there.
That sounds great. Perhaps in just the last 10 or so minutes that we have, and I think directly in response to what's been shared, I will navigate over to the vaccine library and then the general COVID library, just to really demonstrate, the different ways we've seen our platform used. I've navigated to what we call the general message library, and this is again a bit broader, just in addressing things like public health guidance, hygiene, medication, and then of course just offering patient support, which Greg is describing. So all of this is available to folks, and what's really unique about this library is that it was developed by our team, yes, in anticipation of the messaging use cases that we knew health centers would need. And then quite a few of the messages, or quite a few of the topics actually, were created in response to the requests from health centers. So stress management is a really important topic, and one that we had a few templates for that expanded greatly as we heard that need from health centers who wanted to address, the circumstances that they knew their patients were in, and things like guided imagery or medication, just as a way to reach out to their community and their patient population. So I want to call that out here, just in the general message library, as well as the ability to do things like recall. So we saw an FQHC in South Carolina actually use CM Lite as they were reopening their regular preventive care services, and being able to use the free solution to reach those patients, let them know that despite all that's happening, it's still important to come in for that, and that they've done the work to make it a safe experience for those who are coming in. And so there's an abundance of ways that CM Lite can be used to address the most pressing messaging needs, whether it's related to the vaccine or not. With that, I'm happy to stay on for another minute or two, but also, want to just thank everyone for joining today's webinar, for participating in the discussion. You will again receive follow-up from our team with the recording of this call or webinar, as well as the presentation deck. And feel free to reach out with any individual questions that you may have.
Thank you very much for the information.
Of course. Thank you, everyone. Have a great rest of your Tuesday, and stay safe and healthy.